Well, if you have ever gone under the knife, chances are you have something to show for it, like a big scar. Well, if you know what to ask for, you may be able to avoid unsightly scarring. One of the Valley's top docs for the last 15 years, Dr. Mosharrafa, is a board-certified plastic surgeon and is using a product that will help your scar heal so it's, I'm going to say, almost invisible. Dr. Mosharrafa, tell us, what is this new product?
This is a product that's called Embrace. It's made by a company called Neodyne Biosciences. It's a new medical technology company in Palo Alto, California. And it's essentially changing the whole landscape, raising the bar for scarring, and it's been available for about a year now.
It's amazing. So how does it work technically?
The way that this works, this is amazing. It's a $2 billion a year industry, and believe it or not, none of the other products have ever been shown to work clinically. This does not use chemicals. It simply removes tension off of the scarring.
Which is what causes scars to look ugly?
Absolutely. It's tension across a scar line, an incision line, that causes scars to look unsightly, be thick, and more noticeable. This device simply reduces in size after it's applied, hence taking the tension off of the closure, and believe it or not, it minimizes scar formation by up to 90%, and that's been shown scientifically.
That is amazing. Now let's talk about what types of scars that it works best on. We have some treated and untreated examples, and this is coming from those clinical studies, right?
That's right, and in practice now, because I've been using it for about a year. These are before and afters with treated and untreated on tummy tuck scars. I use it on all my tummy tucks or abdominoplasties, on the arm surgeries that you're going to see in just a moment. Any scar that's closed under tension will show improvement. And so you're seeing the difference on the left. One of the worst scars that I've seen with an arm closure compared to one that's treated 8 weeks after treatment on the right-hand side. So it is absolutely mind-boggling. The patients love it. It's exciting not only for patients but for physicians alike.
And the thing is, if you're going in for surgery, you need to ask your doctor for this, right?
That's a great question. It's really traveling across the country very quickly. A lot of plastic surgeons have it at their disposal now, but there are some that still don't. So it's in the patient's best interest to ask their doctor, are you using Embrace scar therapy? If not, the doctors can certainly buy it from the manufacturers, and there's also a website that patients can educate themselves on at embracescartherapy.com.
Yeah, I actually went to that website and learned a lot, but this is basically what it looks like. This is the product itself right here, and this is something that is you use, not the patient doesn't use them themselves. You do this on the patient. Can you demonstrate on my arm how it works?
Yes, we put this on initially about 1 to 2 weeks after surgery, and then it's up to the patient. If they can't come in for the weekly dressing changes, we will educate the patient's family member to do it for us. So it can either be applied by the physician or by the patient or family member themselves.
So you use this as a guideline. So if this is where the scar was, this is where you're going to put the
That's
center
correct.
of
This
it?
black line represents where the incision is.
Okay.
And it's got an adhesive surface on each edge. And I'm going to pull off the tapes that will release it from the backing. And then just remove this, and there's your bandage to show it. And what this has done is it's basically shrunken, taken the tension off of the closure, so that will then reduce scarring.
And now this is something that you do not like immediately after surgery. This follows how many days after
About
post-op?
7 to 10 days. We want that incision to be clean and dry without any drainage at all. So we typically apply it between 1 and 2 weeks after surgery, weekly, for a period of 8 weeks thereafter.
Okay, so here's the big question. A couple things. You've said too that people who have darker pigment in their skin have a tendency to scar more. This is excellent treatment for them?
Absolutely. Skin type is not a barrier. You can put it on any skin type patient, and obviously patients who are darker do make thicker scars, more noticeable scars.
And I know somebody at home is watching right now and say, I have an ugly scar and I'm looking at it right now. Will this work?
It will, but my recommendation there is to have the scar revised surgically first, because if you have an old scar, this probably won't make a difference. But if you have that scar that you don't like, have it surgically removed, reclosed, that's the time to employ the Embrace therapy. And
you've been doing, you've been a cosmetic surgeon for a long time, almost 20 years, and you're really excited about
I got to
this.
tell you something. I'm seeing scars that I've created over the past decade and a half, and now I'm seeing new scars. With this therapy, it's night and day. It's thrilling for us. Patients are excited. It's really a win-win for everybody involved.
All right, there you go. To learn more about Embrace, all you have to do is visit embracescartherapy.com. You can also contact Dr. Mosharrafa at mosharrafa.com. Thank you so much.
Thank you for having me.